That is an excellent point because a lot of people think breast cancer is just that mammogram or that MRI or some radiologic imaging, but um, the clinical breast exam and the self breast exam are also part of screening. And I know back in the day, we used to get those little shower holders that demonstrate how to do the self breast exam, and it encouraged the self breast exam, every year, and then also a clinical breast exam. Well, and this comes from studies, and of course, things are driven, if there's less that needs to be done, sometimes that's what's driven and like with the insurance expects and all of that. So over the years, we used to say, okay, we're going to do that clinical breast exam in conjunction with the mammogram when it's indicated. Now the American Cancer Society, well, actually, the American Cancer Society, the American College of OBGYN, and then also the National Comprehensive Cancer Network, they recommend, instead of necessarily the self breast exam, they call it breast awareness. And so my question is, how do you become breast aware without the self breast exam? And I'm
Mm,
kinda old school, so I do these breast exams, and during the clinical exam, I'm teaching the women, how to go about, make sure you cover the whole breast, what breast tissue feels like, what's abnormal as far as with the skin or the nipple or nodes or along the clavicle or under the arm, and the fact that you can have and you can feel something on a clinical exam that may not show up on mammogram. So that's why you need both. And a lot of people are like, oh, yeah, I do my self breast exam, but they often forget about the clavicle, feeling a knot up here and below the clavicle or the collarbone and under the arm. And the other fact is when when women find, usually they'll come in, and I know there's false positives, and we talk about the people getting unnecessary biopsies and additional imaging and the cost of all of that. But women find their breast cancers. And so it matters to that woman. So, and over the years, I've had women have a normal mammogram and they come in and like, but I got have this lump. Like, oh, no, 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 no. We need to get this taken care of. You need to get it checked out. So it's important for women not to get too comfortable or think that it's okay if the mammogram is normal, but they feel something abnormal in their breast. So whenever you feel anything abnormal, or you see dimpling, or you see skin changes, or there's a rash, you need to go to your doctor and get checked out. So what you said is like so important because a lot of people don't know that.